Indeed, this need for innovation in health and development is more relevant than ever. As you might have heard, the U.S. Development Agency USAID has announced the termination of over 80% of its programs. How can Africa meet the challenge of a new era of development with fewer foreign financial resources? These are some of the questions our journalist Laurence Soustras asked our guest Érick Maville, a health expert and founder of the association Health in Enterprise.
Érick Maville, hello and welcome to Initiative Africa. You created Santé en Entreprise, Healthcare in Business in 2011 to promote workplace health. What exactly is it about and what kind of issues did you want to address?
We indeed created healthcare in business with entrepreneurs in 2011, so almost 15 years ago now. We started from the observation that we needed a space, a framework, for these leaders, mainly from large French groups operating in Africa, to reflect and share certain health-related concerns and challenges, and possibly implement what we call collaborative projects. These are projects where they pool resources to promote health. For example, HIV was a major topic at the time. These large groups faced very concrete problems with executives who could be exposed to these diseases, and malaria too, which has always been an issue. The initiative started there, and now we have actions in about 10 African countries.
Why is Africa's health situation so particular? Is it because of issues such as medical coverage, or its precariousness, or the rise of non-communicable diseases?
Africa first faces a severely underfunded health sector that heavily depends on external funding. There's often a lack of infrastructure, with hospital facilities and health centers mainly concentrated in capital cities. Outside major capitals, in the country's interior, there are very few possibilities for accessing healthcare. Another element is diseases that particularly affect Africa. Take malaria, for example, 90% of cases are in Africa. HIV, tuberculosis, Africa is somewhat the epicenter of these major communicable diseases. And with demographic transition, population aging, and especially changing lifestyles, Africa now also faces problems we thought were exclusive to northern, wealthy countries, like diabetes and cardiovascular diseases. Current projections show that Africa will see more than a double increase in diabetics by 2045. It's the continent that will face the most difficulties in this regard. So all this presents many challenges to address. And when you're a business, you have to take this into account.
To adapt to the continent's needs and conditions, you created health caravans? How exactly do they work?
Given these difficulties in accessing healthcare, we thought it might be better to consider mobile, connected itinerant devices. We started connecting these caravans, especially just before COVID, to reach out to populations and offer awareness, health education, risk factor assessment, and early screening. Because, as you know, the earlier we screen for certain diseases, the more we delay complications and the less costly they are to treat. That's really what the caravans are about, Specifically, we have quite light units. We chose to use all-terrain vehicles that are really light, which can be driven by a nurse. On board, there's absolutely everything. All medical devices, equipment, consumables for screening hepatitis, diabetes, high blood pressure, and the connection we have with an embedded data collection system allows us to collect data. Which is important because many countries lack data. There are regions where we don't know the prevalence of certain diseases. So this is a solution we're now deploying in more than 8 countries, including Côte d'Ivoire, Senegal, Guinea, Benin, Togo, among others, and Cameroon. It's a solution that countries are increasingly considering because it can help them respond to this need to offer solutions and health access to populations far from the health system.
One of the missions of the caravans is elderly care. What are the specificities and urgencies for this age group in Africa?
Especially regarding non-communicable diseases like diabetes, hypertension, cardiovascular diseases. What we call seniors or elderly, for us, starts from age 40. Often these are adults. Many are still active. And many in this age group, we realize that both men and women have a problem accessing early diagnostics. So that's where we say, if we're going to make a difference with these diseases, it's by particularly targeting this adult population. That's why we had to focus. We decided to give priority in the caravans to this population by targeting them. This doesn't mean we won't screen younger people, but let's say we'll prioritize reaching out to these populations.
Now, about sports. There was the first edition of the Summit on Investments in Health Systems in Africa held in Abidjan last February, and there was much discussion about the link between health and sports. Is this the beginning of an awareness raising in Africa?
Yes, really. We can say there's a genuine awareness of the benefits of physical activity and sports as a means of prevention, particularly for preventing all these non-communicable diseases. So initiatives are starting to emerge. Sports complexes are being developed with public-private funding. Companies themselves are also starting to bring speakers to the workplace to raise awareness among their employees about these issues. And outside companies, in communities, major initiatives are beginning to develop. I'll mention the EduCafa caravan that's coming soon, where with the UEFA Foundation, we have a caravan focused on the theme of sports health to promote daily physical activity and campaigns that we now focus completely on this subject to raise awareness with step challenges, to tell people, do your 7,500 steps a day for a week and we'll tell you all the benefits it represents for yourself. And if we can do it as part of a challenge where it's convivial, it creates conviviality. It creates connections between people. So there's real awareness, and that's good.
As we have heard, the development sector is going through a very dark period with the elimination of more than 80% of US aid programs. As a specialist in these issues with partners in Africa, what consequences do you see emerging?
What's happening is dramatic. I think we really need to realize that today we have programs that have completely stopped, very concretely. Treatment programs for people living with tuberculosis, HIV, distributions of mosquito net campaigns to fight malaria are at a standstill. For people who are under treatment, the prospect that we can no longer treat them is dramatic. There's even a risk of death. So I think what we're seeing is people, organizations that were funded, countries receiving American funding who are wondering how they're going to get through the year, and very concretely, some NGOs are laying off staff and stopping programs. So it's dramatic, But perhaps it's also an opportunity to ask ourselves real questions about what we call health sovereignty in African countries.
What actions would you recommend to African countries in the healthcare sector to break free from this dependency on development aid, which is becoming quite unpredictable?
At the African Union level, there needs to be an initiative for all African countries to decide to increase their health resources and budgets. This is really urgent, and major donors, other than American ones, should also consider what resources they can redeploy. Then there's the private sector. It's also time to explore innovative financing, particularly what we can get through the private sector to raise funds.
The health caravans are actually sponsored by the private sector, for example. There's a lot of talk about public-private partnerships. What are the advantages and pitfalls to avoid when working with the private sector?
The advantage of the private sector is having fairly direct resources. It's easier and often quicker to obtain private funding. Because with public funding, project calls, there are obviously much longer processes. There's also slowness in disbursements. Just because you've obtained the grant doesn't mean you'll get it right away. And often, you get the balance when the action has been finished for a long time. The advantage with private funding is that the money is available. It's yes or no. But when they tell you the money is there for the year, you know you can operate. The pitfall and difficulty is that a company won't guarantee funding for 3, 4, or 5 years. It's often one-time funding. So you really need to try as much as possible to bring together, and this is what we try to do, multiple private partners, what we call resource pooling, and seek public funding to have both aspects, walking on both legs, as they say.
Now you constantly call for innovation and you've created platforms adapted for healthcare professionals, particularly for their training. What impact do you see artificial intelligence having on all these health systems? How are you working on this segment yourself?
In 2 ways. First, we've seen how today there's an ecosystem of what we call startups and digital health, where there's an incredible proliferation of startups developing truly extraordinary solutions. The difficulty these startups often face is moving from prototype to scale and finding funding. So we first set up a platform called Digital Health, Sandy Portis in French, Health Tech for Good in English, to detect, especially in French-speaking countries, startups developing promising solutions. Often, these are startups that need support with how to make a business plan, how to manage communication, quite concrete things like having their website, etc. That's the first thing we do in terms of innovation. The second thing is training. There aren't many doctors, so we also need to focus a lot on what we call paramedical staff, nurses. That means taking into account the human resource difficulties, medical demographics that exist to use doctors in the best way. And then the other thing with artificial intelligence is sports health. Today we have startups developing, and I'm thinking of a startup from Ghana that's developing a virtual sports coach solution with AI. We can do extraordinary things with AI, and in our caravans, these are the solutions we're integrating today. It's innovation that needs to be well calibrated, well integrated to have a service that's quality from end to end, allowing us to treat people, to do prevention, because we don't have enough human resources in place and we can do many things with remote interventions. So this is really for us the role that innovation should play, but we won't be able to replace people. Human resources will remain important. We'll still need to focus on the human aspect when we talk about health.
Quand on parle de santé.